Good. Okay. I think we'll start in the meantime. My friend from South Africa, he said he's on his way. Oh, good. Welcome. So you know Denise, so she will take the questions, but and luckily at this stage we are only a few here, so you don't always just have to go in the chat, but we're having the chat also the website and those things where you can link with me afterwards and ask questions. So firstly, what I want to make clear, this is not medical advice. This is not like you should do this and to do that. This is a lot of stuff that I've researched and I've worked with over the last 30 years and especially the last 5 years, 4 years. So why I studied osteopathy was basically I wanted to help people become or living pain-free, right? Because bottom line, people don't go to an osteopath because they are healthy. They go there because they're in pain. And that is always our goal with all these things, with personal training even, or with Pilates. It was always people come with pain and then they want to reduce their pain. I came across Dr. John Sarno's book titled Healing Back Pain, but without any exercises, without surgery, without medication, or without any physical treatments. And that really made me think, it's like, what am I doing if I'm been treating pain for all the time? And this guy says, we can do it, live pain-free without any of these treatments. And that's how I got onto the neuroscience of pain and what is pain. And part of that, I also came across a guy's book called The Biology of Belief. And it is about belief, how your brain is actually working into our body. Because Dr. Sano also called it the mind-body effect. Well, they've come to a conclusion that pain is a neuroplastic symptom. So neuroplastic means learning. It's a learned response. So riding your bicycle is a learned response. So the more you do it, the better you get at it. So if pain is classified in the same aspect as that, then pain is a learned response. And so now today's topic, how do we run pain free? But my question is, why do we have pain? And why doesn't these running injuries heal? Because if the biology is the body heals itself, all injuries heal, a broken leg or torn muscle, a cut in your arm, that heals. So why doesn't these running injuries that we were going to talk about, why do they take months to heal, even with the treatments that we get for it? Now, first, let me come back to the word pain. So what is pain? Pain is a danger signal from your brain. Pain is not a tissue or tissue damage signal. And what I mean by that is, if we think of it, if you are in Africa, where Ivory is, and you run away from a lion and you twist and you break your ankle, then you are not going to feel the danger, or you're not going to feel the pain, because the danger aspect in your brain is the lion chasing you. So you're going to run away on that broken ankle. And then you will clearly feel the pain after the lion is gone and you're sitting safe. Then you'll probably feel the pain in your ankle. But it's not the tissue damage. So the pain that we feel is a message basically from your brain, or the sensation that we feel. Now, so for today's talk, we're going to look at three areas: feet, ankles or leg, the lower leg, and your knee. So we'll just look at those three. What do you call pain underneath your foot? Plantar fasciitis.
Yeah.
Okay, good. and the back of your leg,
Yeah.
hamstring issues.
Achilles, calf pain. Yeah, I have that.
What's that?
Achilles.
Achilles,
Yeah, calf pain.
calf pain.
Yeah.
So Achilles, or what they call Achilles tendonitis or calf strain. And in the knee, they call it favorite runner's knee. And that is mostly because what they say, oh yeah, runner's knee with old people is called arthritis. With runners, it's called runner's knee. It's basically the same thing. Or you can get, what they can say, meniscal tears or subpatellar tendonitis on that tendon just underneath your kneecap. And I always got good experience about that. My point on this is, so for all these different pains that we've got in our body, we've got a certain diagnosis. Feet pain, plantar fasciitis, heel pain or Achilles tendonitis, for your knee as well, or everything that goes on there. And then, pain in your hamstring, it must be a strain or something like that. Basically, there's only one type of injury. That's acute injuries. You break your leg, you need medical attention. You tear a muscle, there'll be clearly blood loss or bruising, or you cut yourself, blood loss. Those are injuries, so they need treatment, and then they will have their own healing process that happens from immediately after the injury. And with all injuries, there's bleeding involved. And that bleeding is, so think of a scab or a cut in your arm, there's free blood flow. And with free blood flow, the first response to that is an inflammatory response. The inflammatory response is there to clean the debris out. Inflammation only happens when there's bleeding from tissues. If you've got a scab on your arm from that cut, and a nice scab is there, and you go and scratch the scab off again, then you're going to have another inflammatory response, right? Until new scab is formed. Inflammation is those first few days after a physical injury. Why do we have this pain in the back of your leg or underneath your foot? And I believe this is, again, going back to Dr. John Sarno. He called it TMS, or tension myoneural symptoms. So basically muscle cramps. And we know from experience that any muscle cramp is quite painful, right? So you get the pain in the muscle that's cramping. But now, my question is, why the muscles in your calf or why the muscles underneath your foot? It comes from a belief. And what I mean by that belief is, am I wearing the right shoes? Have I got flat feet? Am I running on the right surface? Is there enough cushioning underneath my shoe because I'm wearing my knees out? Or am I causing more damage because my heel drop is too much and now there's so much more tension going through my Achilles or my calves? So we create this whole danger mechanism. And from what I said earlier, we know what danger does. Danger increase stress. So it increase cortisol, adrenaline, tension in your muscles. So those muscles underneath your foot is basically cramping because you are saying to your body that by running with the wrong shoes, you are going to cause more damage to your foot. Or by running on the harder surface, you are going to cause more damage to your knee. So the muscle tension is basically there then to protect that movement. It wants to stop that movement because we know for muscle spasm, you can't move. So we are creating that stress response in your brain due to that danger signal. Just on that point, if we know that pain is a danger signal, as an osteopath, and I'm guilty of that, as a Pilates instructor, as a personal trainer, I'm guilty of that. How did we treat Achilles tendonitis? How did we treat plantar fasciitis? We treat it with nice cross friction, shockwave therapy, rolling your foot on that roller. So we created more pain to treat the pain. But if the pain is a danger signal, how do your brain distinguish between, oh no, this is good pain and this is bad pain? The brain can't distinguish between the good and the bad. So it's only one thing. Pain for the brain is danger. It's not health, right? So the same logic is you've got a dent in your car. So let's go and put another dent in to cancel the first dent. We don't do that. So the only way we can treat pain is basically we need to find what's the opposite of pain is safety. Opposite of danger is safety. So we need to treat the body safety. And then why will the muscle spasm if I'm in safety? I want to make a quite important point here. How do we strengthen a muscle? We have to exercise it. We have to put a stress through it to make a muscle stronger. How do we strengthen a bone? We have to put compression through it because then the bone gets stronger. And then the favorite one is the knees wearing out. In the knee, we've got this thing called synovial fluid, right? Synovial fluid is like an oil, it's like the cushioning. But that synovial fluid doesn't live inside the joint surface. It lives in the membrane around the surface. And that fluid can only be released by pressure. So the more you run, actually, the more pressure you put through, the more this fluid is coming into the joint. Now, giving that joint a lot more cushioning. So where does this thing comes in from? We're wearing it out by all our running. So then, Mitch, you should be 5'2" now from all your running, because if you're worn out from all your running, you should be down here. And me as well.
No, I'm not. I might not be sitting down.
Yeah, you're right. But see, it's like if we look at the body, how we get stronger, we need to put those good stresses through it. We don't wear out. It's one of the biggest myths. Rest is another myth because we get weaker if we rest. We don't get stronger if we rest. We can't feel somebody else's pain. And the pain that you feel in your body is real. I'm not saying, oh no, it's all you make it up. And the pain that you feel is real because that, like I said, that calf cramp that you feel in your calf is pain. But the mindset that we've got of when you calf cramp, then you don't believe that there's a problem with your ankle, right? But when you feel a sensation in your Achilles, then you believe that there's a problem in your Achilles. If you feel a sensation in your back, then you believe it's the problem with the discs. But it's a muscle cramp. See, that's where the belief comes in. This is what we've learned all the years. It's like you've got pain underneath your foot, so there must be inflammation. But like I said to you, we can't have inflammation. So that's why I say it's not like now go out and say the pain is not there. Of course the pain is there, but pain is because of stress response, because of adrenaline that you were saying earlier. That child that cried because he fell over and grazed his knee. So he didn't cry because he grazed his knee. He cried because of his cortisol has been raised in that action. Now you go over and you kiss his knee better. Did you fix that graze? No, you didn't. But he's off running again because I'm okay. Daddy just kissed it better. or mommy kissed his better. So it's like what you've done to him or her is you increased oxytocin, the love hormone, the feel-good hormone. So now they're safe. They know they're safe. Off they go. And that's the same that happens with us. But we are creating this whole danger that my knees are wearing out with all this running and more damage through my muscles by using them so much. You know, when does your muscle decide, no, by this is going to cause damage, and by this contraction, I'm going to make it stronger? It's only doing one thing. It can only make it stronger if you use it. And this is the favorite saying. If you don't use it, you lose it. So that's why I think this whole message about pain and damage is wrong, to say it bluntly. We need to change that message and create safety in people. And that's where this work comes in, is creating that safety through the education and people to understand and suddenly realize. I had a client, he had 50 years of back pain. He couldn't run, he couldn't really exercise. And in 4 weeks' time, he had no pain. And I didn't even touch him. We were working online. And it was like, how did that happen? Because he changed his belief. Now he runs up to 10Ks, he plays football. He's a football coach for his daughter's team. He's busy there. Nothing. He's got no symptoms. And he had basically symptoms every day. Trainers are telling, don't do this because you're going to create more damage. This is what I'm saying. How can you create more damage through running if that's what's making the knee stronger? Again, when does the body decide, today I'm going to make it weaker? The only thing that caused damage is you falling off your bike. Car hitting you, dog running in front of you, and you fall over. You break your arm. That's damage. But a pain is not damage.
How did that manifest, as the young people say, in that conversation? You say you didn't even see the guy, it was just conversations, and we went from 50 years of back pain to no back pain. I mean, it almost sounds like hypnosis. I mean, what were you kind of saying to him?
There's a technique, right? This is this program that I run, because it is changing our belief. So firstly, is that belief that there's nothing wrong with you, that your body's fixed itself, that break you had 20 years ago is not the cause of your pain now, because that injury is healed, and your posture has got nothing to do with your pain. That is just the way you run or the way you swim. And then basically what we call it is we do expressive writing, because I need to calm his nervous system down, right? Because like I said, all pain is because of a stress. It's chronic stress. It's your personality. It's your upbringing. It's PTSD. We all have PTSD because most of us being a little bit bullied at school, or mom didn't do this, or traumas that you receive, and we classify it as normal, but it's not normal. You know, it's stress. And we live with that later on. And then your brain has remembered all those things. And then it just comes up subconsciously without you even knowing. It's like the lie detector. You know, your subconscious is picking it up. Your heart rate is picking it up. And then you get the daily stress, and then it's just pushing you over the limit. And where we're saying is your body feels the pain, but it is because of what's going on in here. As an osteopath, it changed my life. It changed my life, just the way we look at pain, and we're getting people out of pain. I specialize in musculoskeletal pain, back pain, but it's actually all symptoms, because all symptoms we feel in our body is because of the stress response. That's what I teach. We don't have to have pain. That's my main thing. We don't have to have pain, but we must have pain for the right reasons. Because if we don't have pain, we will not survive.
Apologies, I did miss the first 25 minutes. Is your discussion focused purely on muscular issues or skeletal? The reason I ask is that when my hip was wearing itself out, and when I had it operated on, they said basically it was down to bone on bone. That was causing me a lot of pain, but I would consider that to be a sort of genuine pain, that there's a body sort of crying out saying, geez, you're grinding your bones to pieces. Is this purely muscular that we're talking about, where increased exercise will make you stronger? Because for me, increased exercise seemed to be making it worse.
Okay. One is, if we exercise, then we're making the muscle stronger, right? This is the funny thing, is because they say there's a problem in your hip. So your brain sees the problem in your hip. They've given you the pictures, the problem is in your hip. Now you exercise, what are you using? A muscle, right? So you've got this danger in your hip. And now the muscles are there to protect your hip. So with the stress, it increased the tension in your muscles. Now you go and exercise this muscle, so you're increasing more tension in the muscle. So it's going to cramp even more. So if you've got a muscle cramp, what's the best thing to do with it? Let's contract it more. It's going to cramp more. That message that they give you, what do you see bone on bone? You see danger, right? So what's danger is stress. So that's how the body responds. So you cannot feel pain in cartilage, because cartilage is, in a sense, dead tissue, right? Now, with the joints as well, because they paint this picture that you are so damaged, and that's the stress. Because you've not been walking on one leg, so why is the other leg not worn out? Why is it only this leg that's worn out? You know, and it's a lot that message. You know, we did say it earlier. It's the message that we say, you're using the wrong shoes, you're running on the wrong terrain, because by running on these things, you are going to cause more damage. But I did say as well in here, the more pressure you put through a joint, the stronger we get. But the pain that we feel is because of the muscles, not because of the joint. So with this work, I will say, I can't fix the structures in your hip, but I can take the pain away. If you want more information, we can chat and see how I can take your pain away.